Hello, this is Gowsalya from Department of Nutrition and Dietetics, and today I am going to take a topic about phenylketonuria. So, phenylketonuria is an autosomal recessive disorder which is an inherited disorder which can be transferred from parents which may have a recessive gene, and due to gene mutation it may be inherited to the children of their family. So, parents having this genetic disorder may transmit the gene to their children and they may get that condition, phenylketonuria. So, the mutated gene in the body results in deficiency of a liver enzyme called phenylalanine hydroxylase. So, phenylalanine hydroxylase is the enzyme which is used to convert phenylalanine into a non-essential amino acid called tyrosine. So, basically phenylalanine is a essential amino acid which comes under the category of classification of amino acid. Phenylalanine is an essential amino acid which should be converted into a non-essential amino acid which is called tyrosine. So, the enzyme which helps to break down the phenylalanine is the phenylalanine hydroxylase. So, patients with phenylketonuria lacks the enzyme phenylalanine hydroxylase. So, here phenylalanine cannot be converted into tyrosine. So, this is the condition called phenylketonuria. So, because the enzyme is either missing or defective in its activity, the PHE level, that is the phenylalanine level, become elevated and harm the developing central nervous system of affected persons. So, if it keeps on building up in the body, it damages the brains, especially the central nervous system, brain and spinal cord. So, the patients with phenylketonuria should be monitored for their phenylalanine levels in their blood, so that it can be eliminated in the earlier stages. So, the body takes in phenylalanine from the digestion of protein, and once it enters into the body, phenylalanine is divided and or broken down into further groups, or with the lack of enzyme phenylalanine hydroxylase, it should not be converted into tyrosine and the phenylalanine builds up in the body. So, tyrosine is a non-essential amino acid which is essential for PKU patients, because without phenylalanine hydroxylase it cannot be produced in the body and the breakdown of and leads to high breakdown of, and it cannot break down the phenylalanine in the body. So, tyrosine is necessary for the production of neurotransmitters such as epinephrine, norepinephrine and dopamine. So, these are the hormones which are helpful in regulating or transmitting signals from one neuron to another neurons. So, tyrosine is very much important for the transmission of signals inside our brain. So, these are the neurotransmitters. If tyrosine is not produced in our body, and these further hormones which may not get secreted in our body. So, after taking the food, proteins are break down into further amino acids. One of the amino acid is phenylalanine, and phenylalanine should be broken down into tyrosine. If it gets not broken down, it will stored up in our body and damages our brain and spinal cord. So, the incidence of PKU varies widely in different human populations. So, in India, the rate of phenylalanine cases is 1 in 18,300. So, the symptoms of phenylketonuria includes hyperactivity and skin rashes, neurological problems, small head size, that is microcephaly, and there are numerous behavioral problems we may observe in children and the adults who developed phenylketonuria. So, test and diagnosis. Newborn blood testing identifies almost the cases of phenylketonuria. So, blood test during the earlier stages of human life can detect the phenylalanine, can detect the phenylketonuria. So, if a person has phenylketonuria or a family history of phenylketonuria, doctor may recommend screening test. So, during pregnancy we may take screening test which includes monitoring the blood levels of phenylalanine, so that we can predict earlier the children may develop phenylketonuria or not. So complications, if phenylketonuria is not treated properly during the earlier stages, it may lead to irreversible brain damage and marked intellectual disability. So it also causes neurological problems such as seizures and tremor, abnormally small head, that is microcephaly, and behavioral, emotional and social problems. The children with phenylketonuria may not react like the same as the normal children because they may have some problems affecting the parts of brain. Significant health and developmental problems. So the normal milestones of the children may not be regular as the normal children, and they may have different milestones and which may be a delayed response. So the basic diet principle is reducing the phenylalanine in the body. Even if the children having elevated levels of phenylketonuria in their blood, which should be regulated to the normal levels, that is the desired range of 2 to 10 milligram per deciliter. So, and one of the important causes are the aspartame which is an artificial sweetener and which is incorporated in most of the processed food products such as carbonated drinks, chewing gums, squashes, cordials, and these should be eliminated for the patients with phenylketonuria, or they can be substituted with other substances so that we can eliminate the condition. Thank you for watching this video.